Good morning, everyone, and welcome to Munson Healthcare's COVID-19 press conference. Today is Tuesday, November 23rd, 2021. My name is Diane Mihalik. I'm the Chief Marketing and Communications Officer for Munson Healthcare, and I will be your host today. Today's speakers will include Dr. Christine Nefsey, the Chief Medical Officer for Munson Healthcare, Dr. James Robertson from the Kids Creek Children's Clinic. We're also hoping to have Dr. Stephanie Valdez from the Pediatric Kids Creek Children's Clinic as well, although she may not be able to join us just due to the busyness of practice right now. Also, you'll be hearing from Wendy Hershenberger, who is the Health Officer for the Grand Traverse County Health Department, Lisa Peacock, the Health Officer for the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Also joining us again will be Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. And now it's my pleasure to turn it over to Dr. Christine Nefsey, who is Munson Healthcare's Chief Medical Officer, for an update on our current status and numbers.
Thank you, Diane.
And I don't think we have our slides in front of us. I think we may be having a technical difficulty with actually showing the slides, but if you want to just give us a general update, Dr. Nefsey, on what we're hearing or what we're seeing currently at Munson Healthcare.
Sure. Well, I think everybody is aware that we are still in pandemic stage red. And what that means is that we are seeing a high number of cases that are significantly impacting us operationally. So our positivity rate is currently at 21%, which is the highest that we have seen. Certainly higher than what we saw at our peak of our last surges, and it is higher than what we are seeing at the state level. Additionally, we have, I know this says 131 patients, we actually have 134 patients hospitalized for COVID in our hospital right now. So high numbers there. We'll go to the next slide. You can see how that compares to the rest of the country. Certainly, we are absolutely seeing a surge in numbers right now across our state. You can see kind of across the upper Midwest there, as well as some parts of the Southwest part of the country. And next slide. I do want to talk a little bit about breakthrough cases, because we are hearing some of that in our community, some concerns that maybe the breakthrough cases mean that this vaccine doesn't work and that kind of thing. So I want to make just a couple of points. One, there is no vaccine that is 100% effective. And certainly the effectiveness of vaccines is significantly impacted by how many cases of that particular disease you're seeing in our community. Additionally, we knew that there would be some diminishing, or suspected anyway, that there'd be some diminishing of the efficacy of those vaccines with time, which is why we have a booster shot that's recommended currently. So just to talk a little bit about the breakthrough cases, if you look at our state of Michigan data, only about 1.5% of people who were fully vaccinated meet the criteria of being a breakthrough case. So that means they got both doses, it was more than 2 weeks after, all of those kinds of things. Of that 1.5% of people who were vaccinated that then died, 87% of those were 65 years or older. So all of those high-risk people that we talked about at the beginning of this vaccine, or sorry, the beginning of this pandemic, who are high risk, continue to be high risk. We know that when you're older, your immune system doesn't respond as well. And we know when you're older, you're much more likely to have other comorbidities. So of those breakthrough cases, only 0.25% of those were hospitalized. And again, that hospitalization rate really does continue to remain high in those older members of our community that have underlying conditions. So those people that we've been asking to continue to cocoon themselves, we would still say that you need to be very careful regardless of your vaccination status, being masked in public places, making sure if you're getting together with people over the holidays that they are also fully immunized, that kind of thing. So overall, really, with all the research that's been done, what we know is, again, vaccines are not 100% effective, but the COVID-19 vaccines in particular, like many of the vaccines that we use regularly, are effective at preventing COVID-19 and are specifically effective at preventing hospitalization and serious illness from COVID-19. Next slide. Here, I just showing you, we had been talking previously about our concern for influenza. So we are starting to see some influenza in the state. Currently, there are 2 outbreaks that are being monitored, one at a university and one at a long-term care facility. So we've been lucky so far here in Northern Michigan to have only a handful of cases, but certainly we are starting to see some flu activity around the state and across the country. So just another reason, again, flu is another one of those vaccine preventable illnesses. We would ask that you get your flu shot. And again, we learned last year that those mitigation factors that we supported of distancing and masking, against COVID-19 also work for influenza. So just another reason to continue to be careful. Next slide. So again, we remain in pandemic level red, which shows an overwhelming number of local cases. We continue to struggle with the high number, not only of COVID cases we have in our hospitals, but other acute illnesses that we continue to take care of, and continue to deal with some staffing issues that are also impacting that. Next slide. We want to talk a little bit about the visitation policy. Since our percent positivity is so high, and because we are in pandemic level red, we have adjusted and limited a little bit more our visitation policy. We are acutely aware of how important it is for patients to be with their loved ones. We are also acutely aware of the impact that having lots of people in our healthcare facilities can have on other patients as well as our staff. So we do ask for your patience as we implement this visitation policy. We are limiting to 2 hours visitation for patients that are positive for COVID-19. However, we are continuing to allow our obstetric patients to have a birthing partner or support person, as well as a doula. Our pediatric patients who are under the age of 21 are allowed 2 primary caregivers, typically their parents, but not always. And then we are making allowances for end-of-life patients to have 2 visitors at a time, so that families have enough time to spend time with their loved ones and say goodbye. Those locations, different locations may have some variance on that, slight variance. We are looking at cases on a case-by-case basis as well for some unique situations. And again, please know that during the holiday, we are taking extra steps to ensure that patients can spend some time with their loved ones. The last thing I want to address is really pediatrics. We have said a lot about our pediatric cases, and we do hear from some people wondering why we are pushing vaccines so hard in our pediatric patients when the risk to those pediatric patients is relatively low. I will say, as a pediatrician, I am exceedingly grateful that this pandemic hasn't impacted as significantly our pediatric population as it has our adult population. That being said, we still do see kids who get very, very sick from COVID-19. And with this latest surge, we have seen an increase in the number of pediatric patients hospitalized with COVID-19. There has been some question when you look at the state data about the hospitalizations in Northern Michigan. And I want to make clear, we do not have a pediatric ICU at any Munson Healthcare hospital. So those sickest children would be sent to a pediatric hospital. And the nearest one for us is Helen DeVos Children's Hospital. We work very, very closely with our colleagues there in ensuring that our sickest kids get the best care they can. The other reason, even though that there is a relatively small risk to children of developing serious illness, The other reason that we recommend immunizing children is because we know that they are spreading it to other high-risk people. So again, the Pfizer vaccine has received emergency use authorization from the FDA for children ages 5 to 11. They are getting a smaller dose than adults do. They appear to respond very positively to that vaccine. And so for their protection and for the protection of those around them, we would definitely recommend that children get vaccinated. Again, it has been proven safe. There are millions of people in this country alone that have received the vaccine. So safe and effective and recommended. If you would like to get that vaccine for your child, we do have a number of options for you in our local community. There is a Munson Healthcare Pediatric Immunization Clinic that is functioning at night, in the afternoons, evenings, and for that vaccine. Many of our local family medicine and pediatrics clinics are providing it. All of our health departments are providing it as well. So you can go online and check for availability of that pediatric vaccine for your child if that's the direction you would like to go. And again, we would highly recommend that you do.
Thank you, Dr. Nefsi. We appreciate that update. We are starting to get quite a few questions in from reporters and from our viewers on Facebook. So I do just want to ask that you stick around, and we will have a Q&A session available at the end of today's presentations, and you could submit your questions either via Facebook or directly through the Zoom if you're a reporter. Dr. Nefsi just mentioned the pediatric vaccinations, not only their effectiveness, what we're seeing, and where you can get them. Now it's my pleasure to welcome Dr. Jim Robertson, who is a pediatrician with the Kids Creek Children's Clinic here in Traverse City. And just want to ask him to start his camera and his audio, and then we can ask him a few questions. Dr. Robertson, are you there?
It's not letting me start my camera.
Let me see. Can you?
There we go.
There we go. There you are. Okay. Thanks for joining us. I know that your needs as a pediatrician and your responsibilities to your clinic come first, but we're so excited to have you just answer a few basic questions about what you're seeing in your practice right now, as so many parents are trying to decide whether or not they should vaccinate their children.
Yeah, for sure.
So what are you seeing in your practice right now?
We're basically overwhelmed. There's several diseases kind of running through the community right now. There's hand, foot, and mouth, which is a virus. There's RSV, which is still around. Hearing Dr. Nefsi talk about flu makes us a little stressed too, knowing that that's coming. And then we're just seeing a lot of COVID from our daycare age kids all the way up through school age kids. We're testing probably 20 to 30 patients a day, and feel like a good half of those are coming back positive. We're seeing it in kids as young as 2. And then the problem is it kind of runs through the whole family. And so I think part of what some of the adult people are seeing is people with school age children now are showing up as a large group of people positive for COVID, and it's being driven by all these kids with COVID then bringing it home from school. So
what is the most common question you get asked about COVID-19 from parents these days?
That's a good question. There's a lot of different questions. Like, I think we're getting a lot of questions about the vaccines. Mm-hmm. There's a lot of thought that kids don't get that sick, so why are we so worried about it? And I would say just what Dr. Nefsi said, most kids don't get that sick, but some do. And similar to what we see with flu every year. And then there's questions about why get a vaccine if it's not going to completely prevent the COVID infection. But I think what's concerning from a community standpoint is, and we see that with flu every year too, is that a lot of times when the infection gets into the pediatric population, that's what drives it in the community, because those mm-hmm. kids are what are taking it home and spreading it. So yeah, there's a lot of layers to that question, probably.
And which children are at higher risk of developing worse or symptoms from COVID-19 than others? Are there specific underlying conditions that would contribute to someone having a worse case than another?
I mean, I think that's a tough question. I mean, anybody with underlying respiratory illnesses, anybody with immunocompromised situation, people that are having to be on medicines that compromise their immune system, and anybody with any kind of significant breathing difficulty. But some of the issues in kids have to do with the inflammatory response that you get after COVID. And so we're just telling people, hey, if you see increase in fatigue or what seems like shortness of breath, those are things to take really serious right now, because you can have an asymptomatic COVID infection, meaning your kid had COVID, but you couldn't even really tell because they didn't have much of a cough or much of a runny nose. They can still get a post-COVID inflammatory response, which tends to be the more devastating part of COVID for kids. And those are the infections that end up down at DeVos and involve inflammation of the heart and other organs. And again, not super common. We don't want people to freak out, but it's definitely a risk, and we want people to be aware. And just like anything else, there's a lot of things we don't have the ability to protect kids from. And we want to take advantage of the ones we do, which is the discussion we have every year with the flu vaccine. And I think it's the same discussion with the COVID vaccine. The odds are you would get flu and do okay. And the odds are for kids, they will get COVID and do okay, but there are some that will not. And knowing that we have the ability to prevent that, it makes it very hard on us as pediatricians to feel like we didn't do everything we could to keep everybody healthy.
Thank you, Dr. Robertson. That's very well said. If you have time, we'd really love for you to stick around at the end of the presentations today for the Q&A session. But overall, it just sounds like your practice is extremely busy right now with a multitude of things, with COVID just being one of them.
Yeah, and so we stay in touch. It's kind of a unique medical community here, but all the pediatric practices kind of work together, and we stay in touch once a week. And I think all the other clinics are seeing exactly what we're seeing. Just the numbers are kind of through the roof, and it's hard to get an appointment in a lot of places now, even in the urgent cares. And so we're trying to get in the people that really need to be seen, but it's tough right now. There's a lot going through the community.
It is, and we appreciate everything you're doing to try to make as many appointments available and to keep everyone as healthy as possible. So thanks for all of your great work on that. And again, I'm going to move on to our next speaker, just due to the time constraints we have today, but I would like to have you rejoin us in a few minutes for the Q&A session.
Sure. I mean, the only other thing I wanted to add is that all the major pediatric clinics in town are doing the COVID vaccine in the office. So it is available through your primary care pediatrician if you have one.
Great. Thanks, Dr. Robertson. Next, I'd like to welcome back Wendy Hershenberger from the Grand Traverse County Health Department. And as a reminder, Wendy does not have the video capability, but she'll be joining us by audio today. Welcome back, Wendy.
Thank you. Good morning. So I'll just hop into the bad news, which is the numbers for our county. I'm just going to kind of continue on what Dr. Nefsey and Dr. Robertson talked about. If you can go to the next slide, please. So you can see here the progression that we've seen in this fall from September to November. And I guess as far as trends, important that we've seen a significant increase, actually a doubling of cases in the last 2 weeks. We as a county have had many days over 100 cases a day, which is really our upper threshold that we've seen throughout the pandemic. And we're now averaging between 80 and 87 cases a day for the last week. Our percent positivity with COVID testing is at 20.3% for the county. Right now, that's the highest we've ever seen throughout the entire outbreak. And it's a 3-week sharp upward trend. We're currently at 607 weekly cases per 100,000 population. So that's our rate. Again, that's the highest rate we've ever seen throughout this pandemic. And we've also seen an upward trend recently in the number of deaths. As a reminder, deaths typically lag anywhere from 2 to 8 weeks after the onset of symptoms. That's typically when we see the spike in deaths as well. And for our county, we've had 6 COVID deaths in the last 7 days alone. We're essentially replicating the worst surge we saw in Michigan about a year ago, but there are a few changes. So our average age of a case for November is 40, and by far the majority of our cases are in that 50 and under age range. We do have a range of cases anywhere from weeks up to 101, but by far the largest number are in that 50 and under. Next slide, please. And I point that out just to highlight our vaccination rates. Although overall we are fairly highly vaccinated with that 70.9% initiation and about 65 complete. For the Delta variant COVID, we really need to probably up in the 85% or higher for all age groups. And so when I talked about the cases being in that less than 50-year age group, you can see where we're at for vaccines in those age groups. We now have data for the 5 to 11-year-olds. We're at about 20% for Grand Traverse County. That's through Friday. And that is actually double the state vaccination rate right now, which is about 10%. So that's just a testament to all those local pediatrician groups and Munson and the health departments in the area that are providing vaccination. Next slide, please. So as far as vaccinations at our health department, our appointments have been full for the last 3 weeks, and we do have appointments next week that will be released on Wednesday. We do release the following week's cases around 10 a.m. on Wednesday. So next week we'll be vaccinating Monday, Tuesday, and Wednesday for first doses. Those are typically afternoon, although Wednesday is a morning appointment. In addition to that, we do have dose 2, which are already scheduled. So that's why you don't see as wide availability, because we're having to weave in dose 1 and dose 2 into the appointments. Next slide, please. Also on Friday, boosters for everyone 18 or over was given the green light from CDC and the ACIP. So this slide just demonstrates who's eligible for the boosters. So there's who should. It's anyone who's had the Johnson & Johnson, who's 18 or older, and it's been at least 2 months since their initial shot. All Moderna and Pfizer recipients age 50 and older who have had at least 6 months since their second shot, and all residents age 18 and older who are in long-term care. So those are all who should, and then anyone 18 and older can. And with the numbers we're seeing right now, we certainly do want people to, assess their individual risk and benefit, and just know that the vaccines do work. They continue to be very highly effective in reducing the risk of severe disease, hospitalizations, and deaths, including against the Delta variant. But the Delta variant is definitely more transmissible, not necessarily more severe, but more transmissible, which is why we're seeing the numbers we are right now. Next slide, please. So for anyone 12 and older, our Cherryland Vaccination Clinic, here's the schedule for next week. We do have booster appointments, which will be available starting released tomorrow as well. And those will be next Tuesday, Wednesday, and Thursday from 9 a.m. to 3:30 p.m. Check our website, because we are looking to see if we can expand the offerings through our partner, which is HANU, to help accommodate the demand for the boosters as well. And due to the demand for booster appointments, we are not able to offer any testing next week, just as an FYI. Next slide, please. Also just wanted to go over some tips for Thanksgiving. I think everybody wants to be safe, and everybody wants to see family and close friends too, but there are some things just to keep in mind that you recommendations from CDC and the state health department to help protect yourself, protect your family, your friends, and the community. It's really important that everybody understands how serious this COVID surge is right now, and that you do what you can to protect yourselves and others. CDC and the state health department have both advised to wear face masks when in public setting, regardless of your vaccination status, and that's just due to the high transmission rates. We do have some tools different than we did last year, in that anybody age 5 or over is now eligible for the vaccine. Again, we know the boosters are also readily available, and it is important that people consider all those in order to protect. There's also a growing toolbox of therapies. But again, if we can prevent the onset of COVID, that's most important. And last slide. So we also just wanted to talk about flu. We do have flu vaccine appointments available at the health department. Those are by appointment only. The information is there Monday through Friday, 8 to 4:30 p.m. We essentially take any form of payment, and you won't be turned away if you don't have payment. And we do participate in the Vaccine for Children program. And as far as coverage, we're at 36% for Grand Traverse County, and the state average right now is 22%.
Thanks, Wendy. Thank you, Wendy. Appreciate all of your updates as usual, and everything you're doing and your teams are doing to keep those vaccination clinics open. Next, I'd like to welcome back Lisa Peacock, who's the health officer with the Benzie-Leelanau District Health Department and the Health Department of Northwest Michigan. Welcome back, Lisa, and what are you seeing in your districts?
Thanks, Diane. Happy to be here. Thanks for having me. If you can switch to the next slide, that'd be great. So we are seeing a lot of what Wendy mentioned, similar to Grand Traverse County. The cases being reported daily to my health departments are the highest that we've seen. They're happening mostly in younger ages. Younger ages are experiencing the most cases and the highest increases of cases. Our staffing resources are very stretched while we deal with large numbers of case investigations, testing, and vaccination. We do know that our most powerful tool right now is vaccination against the Delta variant and, the ongoing strain of the pandemic. And so we are placing a high priority on that in terms of health department resources. Our kids clinics are going very well. And I'm happy to say also that, across all of our counties, we are at 10 to 20% of 5 to 11-year-olds having already received their first dose. So there was some pretty brisk uptake initially. We are adding appointments for that age group to meet the demand in the communities. And so we're happy to see that demand and happy to just continue to devote resources to that. We're offering booster shots in all of our counties. They are very easily self-scheduled on our websites. And there are lots of community providers besides the health department that are offering both boosters, first doses for adults, and first doses and second doses for children as well. So we encourage people to find the time and date that works best for them and make that appointment right away to get yourself and your kids vaccinated. We have documents on both health department websites that explain not only where the health department is vaccinating, but where other places in the community where people can get that. We continue our partnership with Hanu Labs, which is a partnership that's arranged through MDHHS to do testing in most of our counties. We're still seeing a really high demand for testing. People should be tested right away if they have symptoms of COVID or if they have potentially been exposed 5 to 7 days after exposure, vaccinated or not. It's really important to go ahead and get tested. We are seeing a high positivity rate with all the testing that we're doing. Which certainly means that COVID is circulating at that high transmission level throughout our communities. And then it's just really important that while community transmission is high and the hospital system is strained, that it's critical that we continue to utilize the protective measures that we have to protect each other and protect everyone while we're getting people vaccinated. Testing and Vaccination Clinic locations and all of our data is available on both websites. They're listed there on the slide. But I wanted to show you a couple of slides, you can go to the next one, that just demonstrate the effectiveness of masking. So this is a slide from the data and modeling update that is provided by MDHHS each week. And they've been looking at school districts with mask requirements and without mask requirements. And this slide really shows us that that top line, that red line, demonstrates that districts without mask requirements are experiencing higher case rates. The three charts on the bottom, you can see that sharper upward curve of schools with few to no mask rules really experiencing much higher cases. And that is playing out in our communities. The next slide. And this slide just really tells us that masking is effective. And when we see those case rate increases, as we're looking at schools with and without mask requirements, that it not only impacts the school population, but it impacts the entire community. So the top line is the 5 to 19-year-old age group. And obviously the bottom slide is schools without mask requirements are seeing the highest rise in cases. But also in that slide, the black line is the rest of the community. And so, we know that what happens in the school doesn't stay contained to the school, and it certainly has an impact on the rest of the community, just as the vice versa is true. So masking works, and MDHHS put out a public health advisory on Friday, recommending and amplifying the message that the CDC has had in place since early August, that we all be masking indoors in public places. And we are still, very much highly recommending that. All the data that we continue to accumulate shows that it works. So I'm gonna stop there. Thank you so much. I'll be happy to be available for Q&A.
Thank you, Lisa. Appreciate the update. Our last speaker today is Dr. Jennifer Morse, who's the Medical Director of District Health Department number 10. Welcome back, Dr. Morse. It's always good to see you, and looking forward to your update.
Thanks. I'll take the next slide. Yep, thank you. So just like everyone else has mentioned, our cases have continued to increase pretty dramatically. As you can see from the graph below, our case rates or case numbers are at the highest they've been as well, just like everyone else has mentioned. Our percent positivity is averaging right around 20%, but we have several counties that are close to 30%, which is really just, to me, quite shocking. Our average case rate is about 570 cases per million, but we also have counties that are 600, 700, quite high case rates as well. So we continue to struggle. We're not able to keep up with that amount of cases. Pretty much similar message to what my partners in the health department field have mentioned. So next slide. We're also working with HANU. My health officer has done a lot of work and gotten some great community test sites set up. So we currently have them in Big Rapids, Kalkaska, and Fremont right now, and have upcoming test sites opening in Cadillac, Ludington, and Oceana. We have had some really good turnout in the short time those have been open. As you can see, in Kalkaska, we're getting close to 1,200 individuals that have gone to be tested. Newaygo, we have had over 1,200 that have gone. Big Rapids hasn't been open as quite as long, but they're reaching 500. And you'll see that the positivity for those test sites is 25 to 30% positive. So, we encourage people to utilize those sites, but again, just a sign of the need for testing and the amount of people that are infected in those communities. If you go to dhed10.org/events, you'll see a calendar that lists those sites as well as our vaccination clinics as well. So I'd really encourage people to utilize those. Next slide. So this just gives a visual of our vaccination rates. This only shows those that are 16 and older by zip code. The more green the area is, the higher the vaccination rate is. But this is showing those that have initiated vaccination. So we're getting there, but you can see we do definitely have pockets of area that are still struggling with vaccination rates. Next slide. And we have begun our 5 to 11-year-old vaccinations as well. Overall, throughout our 10 counties, as of last Thursday, we vaccinated about 5.5% of that age group. Our counties vary. We have some as low as 2% and others that are close to 10%. So it is quite variable, but just like with the other health departments, we really strongly encourage people to get anyone who's eligible 5 and above vaccinated, as that's our biggest hope to really put an end to this surge and the pandemic overall. You can schedule online. However, there are more appointments available than you will find on our website. So I encourage you to call our central scheduling if you do not see one online and wish to schedule. Also, just a reminder in general, vaccines.gov is a great go-to to find all available vaccine in your area, or calling 211 will also help you find any available vaccine in your area. So those might just be easier things to remember than all of our individual websites. So, but really encourage you this holiday season to think about your neighbor, think about your families and friends, and think about getting vaccinated and wearing a mask as a way to help protect those around you, not just thinking about what's maybe in your own best interest, but again, what's best for your community right now. So that's all I have. Thank you.
Well said. Thank you, Dr. Morse. Now I'd like to ask all of our panelists to restart their videos and audio, and we'll have you back for the Q&A session here. We are getting quite a few questions in, both from our reporters and from our viewers on Facebook. So we will launch right into this. I just want to make sure Dr. Robertson can rejoin us as well. Great. So the first question is for Dr. Nefsi. Of those hospitalized with COVID-19 in the Munson system, how many are vaccinated?
So that's a great question, and I actually have the numbers just from this morning. So of our total 134 patients hospitalized for COVID, 33 of them are vaccinated. So that is approximately 24%. Of the 56 patients that are in the ICU, 7 of them are vaccinated. And of our total number of patients on a ventilator, which is 9, 1 of them is vaccinated. So, again, consistent numbers with what the state and others have been pointing out about the effectiveness of these vaccines to prevent significant illness.
Thanks, Dr. Nefsi. And I do just ask that we take the actual slide down so we can just see each other's faces a little bit better. But Dr. Nefsi, the next question is also for you. And I want you to be really honest with your answer here. The question is, in terms of impact on hospital staff, is the current wave better, worse, or about the same as the past waves?
I would say definitely worse. I mean, we prepare for these kinds of things. I think people are probably aware we have disaster plans, and all of us studied history. We know about the disasters that happen, whether it's a pandemic or an event like a shooting or a horrible car accident. So we prepare for those kinds of things. I think that there are a couple of things with this pandemic that maybe we weren't as well prepared for. And one would be the duration. So certainly I think we all sort of rallied and thought when the vaccines came out that was going to be sort of the end of the tunnel. That was the light. And we really thought that things would settle down after that. And when that didn't happen, I think that was really hard on our staff. I think the other thing that we're seeing is just the violence and some of the rhetoric that we're hearing, the distrust that some of the misinformation that's out there on social media has created against hospitals, against our health departments, against our medical staff has been really disheartening. So, those stories that you read of people who are in the hospital and sometimes even dying, who don't believe that they have COVID or, are giving our staff a hard time, just makes what's already a very, very difficult situation all the worse. So, you know, our staff, they've been doing this for a long time, well over 18 months. And, you know, we're now heading into another holiday season where we are significantly impacted by this pandemic. And I just say the duration has been really, really difficult for many of our staff members. So.
Well said, Dr. Nefsi, and I agree with that. And I think, you know, you and I both see every day as we attend these emergency management meetings, just the difficulty we're having in trying to place patients, determine what services we scale back in order to get the right staff to the right locations. You know, talking about how do we expand bed capacity? How do we double up rooms? I mean, I've never seen anything like this in my career, and I don't think you have either. So we do just want we are asking for the public's help in this, because there are distinct measures you can take to help lessen that burden on the health system. Dr. Nefsi, you mentioned some of the violence. One of the questions is the Michigan Health and Hospital Association started an awareness campaign concerning violence against hospital staff. Some nurses have mentioned this occurring at Munson as well. How have we responded to aggressive patients, and what are we seeing? And I'll just start by saying that I was actually planning at one of the future press conferences to have our system director of security on to just discuss some of that and let people know what they can do just to try to be patient. But you know, people are angry for a variety of reasons, not just what you mentioned, Dr. Nefsi. We see people who don't want to wear masks, who don't want to take basic infection prevention measures at our facilities, and it really does take a toll on our healthcare providers. But I do want everyone to know that you know, Munson Healthcare has our own anti-violence campaign. You will see signs in all of our facilities that there's a zero tolerance policy for that. And, you know, we do that to protect our own healthcare workers so that they can continue to care for you. And we just ask for your patience, as wait times may be longer than expected. Some services may not be open right now when you expect them to be. And we just need to all band together and do our own individual part to get through this next surge. So thank you for that question. Dr. Nefsi, you mentioned the pediatric cases. Do you have any indication of the numbers of pediatric transfers that we've done lately?
I don't know lately, you know, it kind of ebbs and flows. And I would say I can, off the top of my head, I know that we've transferred somewhere around 10 patients downstate for more critical care, and we've probably taken care of about as many the same inpatient that had, you know, they were sick enough to be hospitalized but not sick enough to maybe need an ICU. So still, again, I'm exceedingly grateful about the relatively low numbers of pediatric patients that we've seen that have had significant illness. You know, but again, other reasons to immunize. And the other thing I'm not sure that we mentioned is that we really don't have a firm understanding of what the long-term impact of having COVID, even a mild case, could be. So I think that's in the back of pediatricians and others' minds as well as we continue to navigate the pandemic.
Thanks, Dr. Nefsi. Our next question is for Dr. Robertson. Some specific questions about, I think this is from a parent. What should you do if your child does test positive for COVID? How should you handle their symptoms, and what should you have your other family members do?
So some of that probably depends on your family situation, but ideally, exposure they have to the rest of the family, the better. There's quarantining that probably needs to happen, and those guidelines are pretty well laid out by the health department. In general, I would just treat it like a regular cold, in the sense that if they have fever, you treat it with Tylenol or Motrin. If there are other symptoms, there are some cough medicines that you can use if the cough is getting out of control. And then, like we talked about a little bit earlier, I think the big red flags for us in kids are unusual fatigue, shortness of breath, any kind of breathing problem. We would take, if you know that it's COVID positive, I would have a really short fuse on getting evaluated if you were worried about those things. You know, lack of energy, difficulty breathing. And then I think the big thing is trying to limit the spread. And so if you have ability to sequester people away from each other, has that depending on where they live. We've had people that, you know, set up a basement for COVID positive members of the family, and they leave food at the top of the stairs. And, but not every house is set up in a way that that's
Right.
feasible either. So I think limiting exposure as best you can. And then the quarantining, what's so disconcerting to us is like, we'll see people who were suspicious that they had COVID at the beginning of the week, didn't want to be tested, went to school all week, and then got sick enough that they were tested and were positive. And now you're trying to go back a week and figure out who they've been around, who they've been exposed to, who they've exposed. And that's what's driving the spread, I think. I think we should do more testing, not less, if it's possible. And if you're suspicious, try to stay home, just because you can see from the numbers here that, I mean, we're at 25 or higher % positive rate. That's people just kind of letting down their guard and maybe not being as careful as they used to. And I'm sure there's a lot of fatigue. Nobody wants to miss things, but.
Thanks, Dr. Robertson. Appreciate that. The next question is for Lisa Peacock. Do you have any sense of why you think the case numbers are worse in Michigan than elsewhere in the country?
Well, I mean, I think it's a variety of factors. Certainly, we know that Delta is wreaking havoc right now. We have returned indoors after our, summer with nice weather and things like that, and things are always more risky indoors. And I think when you look at the earlier surges in the southern states, when the time that they go indoors is in the summer, when it's really hot. And so, school started earlier in some of those areas. People were indoors at a different time. And we're going through some of those things now. And so I think that's part of it. We have really variable vaccination rates across the state, and county by county, even in our own region, we have really variable vaccination rates. Some counties still well under 50% and other ones up close to 90. And so, the less every hole in the fabric we have, there's another opportunity for the virus to spread. And also, boosters have been approved, and part of the reason for that is the recognition that the immunity does wane. We're learning all the time. The immunity does wane after vaccination after a number of months, and it does wane after natural infection after a number of months. So many of the people who either were vaccinated early on or got sick early on are now vulnerable again. So I think it's a combination of all of those things.
Thanks, Lisa. The next question is for Wendy Hershenberger. Are we worried about another surge or a post-Thanksgiving surge in our region?
Definitely. I think it's just going to continue the current surge, which is our highest surge ever that we're having. And there were a lot of good points that Lisa and Dr. Robertson just made. If there's any indication that you might have it, you need to get tested soon, and you need to stay home and take precautions. And unfortunately, even if that means missing Thanksgiving or something like that, the delay then just results in more people getting infected from one case, which is, Delta's already has a higher infection rate than the initial COVID. And so that just almost doubles that effect. And so, I think we're very concerned, especially if people just continue to just sort of ignore or assume it's a cold. I know there's other things going on out there, but it's best to get tested and know for sure, so you can protect yourself and protect everyone else in your household and the community.
Thanks, Wendy. And someone is also asking, for people traveling for Thanksgiving, is it too late to get a COVID-19 test? Will the results not be back in time?
It's going to depend on the place and the test. There's some rapid tests where you would, have the results within about 30 minutes. If it's a PCR test, it's going to take a couple of days, and it's really going to be dependent upon where the labs are at as far as how much of a backup there is. So hard to answer that without just saying it depends.
And Wendy, just along the same question, since I have you on the line, how long after you get sick should you get a COVID-19 test? Is 3 days going to give you a true test result?
You mean after you've been exposed?
It doesn't say.
Or
It says after
symptoms?
you get sick. So I assume that means symptomatic.
Well, I'll say this in general. If you've been exposed and you don't have symptoms yet, you should get tested sometime after the 5-day mark, because that's typically when the 5 to 8 day range you're going to test positive. Getting tested like the day after exposure is too soon. If you have symptoms, you can get tested at any point once you have symptoms.
Great. Thank you for that clarification, Wendy. The next question is for Dr. Morse. I know we're going a little over our time slot today, but I do think it's really important to keep going for those of us who are able to, just to keep the community informed. The question is, I want to get my flu shot before my booster. How long should I wait between the two?
You can get them at the same time. There is no need to wait. And so I think that's usually the most convenient. I did that myself and it went just fine.
Great, thanks, Dr. Morse. One more question. How can vaccinating kids stop them from spreading it to high-risk people when the vaccine doesn't stop the spread of the virus?
So it does stop the spread. So I think we have a tendency to see things as black or white. Either it works or it doesn't work, things like that. But if you have a vaccine that prevents 90% of infections, if you don't get infected, you can't spread the virus. So again, even if they get infected 1 out of 10 times, you're still going to prevent spread 9 out of 10 times. So again, it's not that it does work or it doesn't work, it's that it works almost all the time. So I think we have to see it as that way, that we're going to prevent spread 90% of the time. And there is evidence that those who do get breakthrough infections have a lower viral load, so they're less likely to spread it. Again, regardless of that, even if we say, okay, that other 10%, it's not going to help them at all, still 90% of the time, we're going to stop spread.
Very well said, Dr. Morse. Thank you. This next question is for Dr. Robertson. Are infants more at risk than older children if they develop COVID-19?
I don't think we're seeing that in general. I don't know that I have the statistics, but I don't think we're seeing severe cases at higher rates in infants per se.
Probably too early to tell.
And in infants, I mean, that's a wide range, but I think if you have a vaccinated mother who's breastfeeding, there's some benefit then to those infants. And so there's maybe some extra protection for really little infants, but yeah, I don't think statistically we've seen it be more impactful on infants.
Great, thanks, Dr. Robertson. And we have one final question for Dr. Nefsi. Is there an age group that Munson is seeing more of in the hospital, or is it a mix of ages?
Well, I think that compared to what we saw early on prior to vaccine, we are seeing a younger set of patients. Still the majority of our patients are adults, but we've definitely seen a trend down towards those younger adults, so 40s, 50s, 60s. And I think that's because, as we've heard from our health department, our vaccination rate in that older population is much, much higher. So we are seeing younger patients come in, but again, the vast majority of those are adults.
Great, thanks, Dr. Nefsi. Looks like Dr. Robertson has to go, so we thank him for his time today. Just one last, thanks, Dr. Robertson, appreciate your time. One last question for Wendy that just came in. Wendy, what's the fastest way to get test results right now in Grand Traverse County? It looks like appointments for the drive-through clinic on Garfield Avenue are booked through January, for example. Where do you recommend people go for the fastest results?
Okay, so let me give one clarification. It's the way our software works for testing. We release appointments on a weekly schedule, so you have to check back every week. You have to ignore the message about it. It changes, and we have no control over when it says there's no appointments until August. So we release them weekly. I would say the quickest way, so on our website, gtchd.org, there is a listing of all the different testing providers. And I know for all the health departments have listing of all the different testing options. in the community. So I would say to go there and start, checking out the websites and see who's got availability. I'm sure there's going to be a high demand for testing just due to travel and due to people having gatherings. So that's the best way.
Thank you, Wendy. I wasn't sure if I should ask that question publicly, but I'm glad I did because I knew that there was an issue with the software doing that. So thanks for clarifying that. Well, this is the end of our Q&A session and the end of this press conference. I want to thank again Dr. Nefsi, Dr. Morse, Lisa Peacock, Dr. Robertson, and of course, Wendy, and all the team behind the scenes that helps to make this happen. We will continue to keep you updated. We do have one final slide to put up, which is our standard slide of some other additional resources from Munson Healthcare that I invite you to sign up for our e-newsletter, follow us on social media, and visit munsonhealthcare.org. And just as a reminder, slide isn't popping up. We're having a couple of technical difficulties today, but just as a reminder, if you have questions and you'd like to use our Ask a Nurse hotline, that number is 231-935-0951. So everyone, please have a safe and healthy Thanksgiving, and we will do another one of these press conferences as soon as possible. Thanks, everyone.